Hi, my name is Dr. David Ponton, and I am the Director of the Institute on Black Life and the Chair of the Racial Justice Initiative at the University of South Florida. I am thrilled to introduce to you today three enterprising and inspiring graduate students who are receiving the HIV/AIDS Research Grant established by the Department of Africana Studies, the Institute on Black Life, and supported by the Racial Justice Initiative. These three students all come from different disciplinary backgrounds, but they share an interest in understanding and addressing the effects of HIV and AIDS in Africa and the African diaspora. Supporting research concerning Black life in Africa and the African diaspora remains a crucial component of what the Institute on Black Life does and what it was founded to do by the wonderful Dr. Jewel Smith in 1986. This vision has been carried forward by so many amazing directors of the Institute over the past several decades. We invite you, as you listen to the stories these students tell, to think about how you might be able to contribute to research and student success at the University of South Florida. And we invite you to contribute to the Institute on Black Life Fund so that we can continue to support student researchers in areas related to Black life, both in the United States and throughout the world. Again, I'm so thrilled to introduce you to these three students. I hope that they inspire you as much as they have inspired us at the Institute on Black Life and in the Racial Justice Initiative.
Okay, my name is Samuel Ilori. I'm a first year MA student in Sociology department. Yourself?
My name is Karah Green, and I am a second year Ph.D. student in the School of Social Work.
Hello, my name is Santiago Hernandez, Bojore. I'm a Ph.D. candidate at the College of Public Health, University of South Florida, and I'm currently working on my dissertation proposal.
I have actually completed all of my education at USF. After I achieved an AA at Hillsborough Community College, I completed my bachelor's in social work in 2020 and went straight into an advanced standing master's of social work, which I completed in December of 2021. In October of 2020 is when I started getting involved in research though, and as I completed my master's, I was also working as a study coordinator on a few HIV projects and decided to apply to PhD programs and become a researcher. So I started the PhD in social work here at USF in fall of 2023.
So I started my graduate school back in Nicaragua. I'm an international student, originally from Managua, Nicaragua. Back there I studied medicine, and after med school I decided to join academia because it's my passion. My dream is to work in academia, do research and teaching. After my med school, I did a master's in epi back home. And after epidemiology, I applied for a Fulbright scholarship, and that changed my life. So I came for a master's program, an MS-PH degree, Master's of Science in Public Health, and I completed my MS-PH in 2020. And after my MS-PH, I applied for a PhD program.
My interest in social problem began while I was so young, maybe in my basic school, when I lost my mom to a kind of a maternal health issue or something like that, and it kind of gave me a kind of tough time during my lifetime. Like while I was trying to go into the high school, I was thinking about, because they told me that it's about one right and rituals in my hometown then, and it's kind of like, what is right and ritual? Because I was so young to understand what they are saying then. I was like, what is that? But I couldn't find an answer throughout my high school, and when I was trying to apply for my university level to go into my undergrad, I was looking for a course I can do that can really give me an answer to what I've been seeking for during my high school, and I found out that there's a course called Sociology, and it talks about human, it talks about society, it talks about social problem. I was like, I think this is what I'm looking for, and that's the reason why I went into sociology as a discipline in my undergrad. And while I was in my undergrad, I think in my final year, I try and do something and seek for answer to question I'm asking for. I went into my mother's hometown That was in Lagos State, Nigeria, in Epe. I did a particular research called the right and rituals of child delivery system in Epe, I did a qualitative research, and I was able to find out some data, and I was like, wow, so this is what they call the right and rituals I've been seeking answer for. And I really found out that truly there is a particular right and rituals in every family, in every society, and it's related to how our women in that particular society truly give birth. And because my mom desired that he has take Jesus, he doesn't want to go into any right rituals or any traditional thing, and that's what brought about the death of her death, and even the death of the baby she was carrying. And I was like asking myself that how did she not give birth to me when I now found out that then she has not take Jesus the way she take two kids then. So it's now like the thing is counter, it's kind of conflict with each other, and she was allowed to choose between that and that. And I was like, why does Jesus cannot save her during that particular period? But I now found out that it's before, even where you say you have Jesus, you still have something they call transition. And transition also, you are born into a family, you share their blood, and a lot of things like that. So you just have to go through it. And I found out that also that even the way they do the rituals, it differs from one family to the other. Because I found out that in some family, the husband had to kill a ram for the wife while she was pregnant, not about child dedication or something, while she was still pregnant. If she did not kill the ram, it's possible the woman will lose herself and lost the baby itself. So that's what really brought me to this journey of seeking about looking at social problems. And I know I've a loss of a mother, but I don't want other women also to go to Canada kind of thing. I really want to enlighten them, people that are not really enlightened, let them know that even though you have Jesus, I also have Jesus, but when they talk about transition, you have to go through it, because the transition is kind of a very thing that is very hard, and you have to do it. So you just have to do it. That's what really led me to the applying to the schools in United States for my grad school, because I feel like I'm still learning in African society. I also want to come to a more developed country to learn about how these things are being done. Is it true that there's also right and rituals in other places apart from Africa?
So I started working on Afro-Latinos and HIV, COVID-19, and other infectious diseases during the COVID-19 pandemic. I'm part of a research group called the Salud Latina Initiative, which is a research group that started during the COVID-19 pandemic to tackle the challenges that the Latino, Latinx, LGBTQ community, Afro-Latinos, and others were facing during the COVID-19 pandemic. And one of the projects was to study the epidemiology and the clinical outcomes in Santo Tomas Hospital, which is the main research public hospital and reference standard for the entire country. So we are currently studying the clinical, laboratory, and outcome features of over 1,500 patients. Most of these patients are trigueños or trigueñas. This means that they are Afro descendants. So most of the Panamanian population that attend to this hospital are Afro-Latinos. And with this study, we will be able to determine whether the risk factors for death and the main predictors for mortality in this subpopulation.
So Dr. Marhefka in Mental Health Law and Policy talked with me last year. She knew I was interested in HIV research, and she was working on a study to help people living with HIV quit smoking. And what she found so far is that people were using smoking to cope with unresolved trauma. And so she wanted to identify an intervention that would be effective in resolving trauma in this population to help them with quitting smoking and other more positive health behaviors. So through my connections with her, I then found out about the IBL grant or award, and I knew that I myself am interested in improving the quality of life of people living with HIV. So we decided, why not interview Black people living with HIV about their trauma experiences, about living with HIV, being Black, any stigma they've experienced, racial trauma, and how that's impacted their HIV care.
And majorly, the reason why I'm going into HIV and AIDS is because I found out that in my community, I found out that a lot of teenagers, they are really having that kind of problem, which about, I was really asking myself, because I have a lot of things running through my mind. I was like, what is this thing about? Because why is it that teenage, that before we have something we call morality, the morality is just lost, and every teenage become very active when they are 10 and they try to engage in sexual activities, and because they did not really have someone to see, because when the father and the mother started divorce and maybe the child is staying with the mother or the father, and most of them, both of them, maybe they are working or something, it's really have effect on the child. And because they couldn't have a kind of interaction with their parents, they kind to seek advice from their from peers, and peers may even lead them to bad things. And I found out that they begin to have a kind of sexual activities with other opposite partner, and when the consequences come, they don't know how to go about. They don't really know about contraceptive use or something like that. And I feel like all those things are a social problem in African society, especially in Lagos State currently. And I feel the influence of social media also have a lot of things to do, but I still want to go into this particular research and find out myself. I don't just want to assume. I want to go into the field and have a qualitative research and have interaction with them and be able to know that, okay, this is what is causing this, and I really want to know what the social and the health consequences is. If we are looking at the health consequences, I'm talking about the HIV and the AIDS. I'm talking about a lot of syphilis infection or something like that. But apart from that, I want to look at the social effect of that, which talks about the social stigma. Like in African society, when a teenager gets pregnant, it's like the career of the teenager have ended. So I really want to go into that and really want to study that particular thing, and that's why I'm looking at the social and health consequences of teenage sexual behavior in Lagos State.
One, especially here in Florida, there's a huge disparity of HIV between people who are Black and people of other racial groups. And so one thing that I want to do with this project, but also in my future career as a researcher, is work with groups who have historically been mistreated or have been part of unethical research, may have mistrust in research community, medical community, those who really need to have their voices amplified by people in a more privileged position. But also, I want to center Black voices. I think that's really important, especially as we're learning more about disparities and that have been long-standing. So I really want to address that in future research. And I want to work with Black researchers. I want to learn what they learn. I want to partner with community members of all races and really center voices that haven't been heard by politicians, policymakers, people in positions of power, and really increase equity in general. Impact, I want to be able to sit down with Black people living with HIV and address and identify what barriers there are in HIV care that healthcare providers can work with them on and promote better health. I want people living with HIV to be more than their diagnosis in everyone's eyes, and I think we're at a place now where living with HIV isn't necessarily a primary part of a person's identity, but it does play a role in who they are and how they live their lives, and I think that's important to consider as a researcher.
Hopefully, my research will help the Panamanian Ministry of Health to create guidelines for the management and treatment of COVID-19 in this country. Each population is different. The US population is different from the Panamanian population. So the management varies from person to person, culturally and socially. The approaches are different. So hopefully this study will help the health authorities in the Ministry of Health to target those issues within the Panamanian population. And hopefully this study will also serve as a guideline to do data recovery, quality control, and data analysis, and even scientific dissemination of the work that we've been doing for 5.5 years. So HIV is a public health issue globally. Where I'm from, Nicaragua, it is a public health burden, especially in minority populations in the Atlantic coast, in the mountains. And we also have hotspots in the Pacific, Nicaragua. And most of the population that presents HIV AIDS problems are vulnerable populations. And I think it's a common denominator in different countries in Panama and here in the United States. My concentration in public health is global communicability for infectious disease. Therefore, I've been working since I started my career with vulnerable populations. So HIV is a global communicable disease, and it's also one of my main research interests currently. And hopefully I will continue working on HIV/AIDS for the rest of my life.
If you're interested in research, find someone who will take you on, faculty, mentor, anything, who's already involved in research, and ask until you get an in. Because I had to ask a few different people, and finally someone took a chance and was like, I know you don't have any experience, but you seem eager, and that made all the difference for me.
I think if we have a kind of opportunity, and if we from Africa like this, we are interested in conducting social research, if we have been given the opportunity to be able to maybe be supported, because to conduct a research in Africa is not kind of easy task. So if we can be able to give a kind of opportunity for researchers from Africa to go into their home country and to resolve problems, it will be a very big opportunity for us. Thank you very much.
Bueno, quisiera recomendarles que sigan adelante, siempre trabajen duro, con esfuerzo, todo se puede, sigan sus sueños y siempre van a encontrar personas o equipos de investigación o de trabajo que los van a querer apoyar. Entonces nunca se den por vencidos y todo se puede. Así que sigan adelante y go for it. I am a Latino international student from one of the poorest countries in the hemisphere. So if I could have done this, I'm pretty sure you can do it. So keep on going, work hard, never give up, follow your dreams, and there will always be people in your home country or wherever you are that will want to help. So keep at it and go Bulls.